Thank you for joining us on another edition of To Your Health here on GBMC's Facebook Live page. I'm your host, John Lazarou. Now, I know many of you have heard of Gilchrist, which is an affiliate of GBMC, and the valuable care that they offer to people near the end of life or when they're facing the end of life. And most of the patient base at Gilchrist tends to be those that are 65 and older. But what many of you don't know is that they also offer pediatric hospice and perinatal hospice care, which is a program that's really designed to help the patient but also help their families as well. And joining us today is Erin Bull, who is a nurse at Gilchrist with Gilchrist Kids, right?
Thank you for having me.
Yeah. Erin, you know, you and I have spoken a lot about what it is that you do and pediatric hospice and perinatal hospice. So I'm looking forward to our discussion today and enlightening our audience. And I want to thank you all for joining us here in the studio and also watching us on Facebook. So, Erin, we got a lot of questions, so let's get rolling. You ready?
Go.
All right, so let's start off with the big one. Can you briefly explain what is pediatric hospice?
Pediatric hospice is a very specific subset of hospice. I think we're all familiar with, most people are familiar with what hospice is. When you think of hospice, a lot of people think of their grandparent or their great-grandparent. When you poll an audience, that's the experience most people have had. And to qualify for adult hospice, you have to be within the last 6 months of your life. Well, that falls true for pediatric hospice as well. To the best of our knowledge, all of the patients that are on pediatric hospice are within the last 6 months of their life. Obviously, kids are not good at following rules. So many of our patients live much longer than 6 months. Many live a lot shorter than 6 months. But we follow very specific regulations in that if their disease followed a normal trajectory, they would only be alive for about 6 months.
So that's pediatric hospice. But let's talk about the other side of the coin, which is palliative care. Mm-hmm. Can you briefly explain what's the difference between the two?
Yeah, that's a really great question. I think a lot of people often ask, is hospice palliative care and is palliative care hospice? And I think the best, palliative care is a emerging thing in hospitals and out in the community. And the best way to describe it is that palliative care is a large umbrella, and hospice just falls underneath of palliative care. So you think of hospice as a small subset of palliative care. All hospice is palliative care, but not all palliative care is hospice.
One of our questions that has come in from one of our Facebook followers, and she asks, what is the difference between pediatric hospice and caring for adults in hospice?
That's a really good question. So in 2010, the Affordable Care Act was passed, and under that Affordable Care Act is a provision called concurrent care. And what concurrent care allows pediatric patients to do, which is different than the adult population, is under medical assistance in the state of Maryland, pediatric patients can receive curative therapy alongside of hospice, which means they're getting the ultimate in-home care through hospice. Social worker, chaplain, nurse, doctor, hospice aide, volunteers, they're getting all that in the home. Plus, they can try to cure their disease, which means they can still call 911, they can still get CPR, they can still go in and out of the hospital. Whereas for the adult population, that varies a little bit, where most adults that are on hospice, they've come to close to the end of the road of their disease, and they no longer are trying to cure it. So we don't ask families of pediatric patients to make that decision because it's a really hard decision to make, to give up curative therapy. I don't think we would have a program, and we definitely wouldn't have any patients if we had to put that decision in front of families, choose hospice or choose getting chemotherapy or choose getting radiation. Of course they're going to choose the curative therapies. I mean, how could you not? Mm-hmm. So we let them, Affordable Care Act allows them to choose both at the same time. So they're getting the best model of care at home and the best model of care in the hospital.
What has been the reaction to this from families that you are caring for their child? What has been their reaction, knowing that they can follow that road as along with what's in front of them?
I think the reason I'm sitting here and the reason that our program is successful is we are always in the community. educating the practitioners and families that that concurrent care exists. A lot of times we sit in front of physicians and nurse practitioners and always in front of families that have never heard of this before. So when we're out there educating, when we sit in front of families and sit down and explain that they don't have to choose, well, then it's a no-brainer for them. Because most people's knowledge of hospice comes from, like I said, their grandmother or their great-grandfather. That's all they know about hospice. So when they hear, one of our favorite things to say to families is, you don't have to give up your team in the hospital. So let's say a cancer patient, for example. They've been fighting their cancer for 5 years, a child. They become very attached to their oncology team in the hospital. And one of the family's biggest fears when we meet them is they don't want to give up that team. They don't want to give up that support. They don't want to give up that hope. And when we come in front of them and we say, we're not replacing anyone. All we are doing is making the circle bigger. We're just adding a component of home care that you didn't have before, and people to call in the middle of the night that will come out to your home, because the hospital teams can't do that. They're constrained by the walls of the hospital, whereas we're a little bit different. And lucky, I think, in this regard, that we can see them in the hospital, and we can go into their home and sit at their dinner table, or go into their school and participate in conversations with a nurse at school. So we're able to kind of break down those hospital walls.
There's a lot of valuable services you just mentioned
Thank
there.
you.
Joining us today is Erin Bull. She is a nurse with Gilchrist Kids. I encourage our members in the audience and those of you at home to please submit your question. For those of you watching us on Facebook, please feel free to add a comment, or if you would like, you can private message us as well. Erin, we talked about, Gilchrist Kids and the hospice and palliative care. Let's talk a little bit about you.
Okay.
How long have you been doing this work? And I know you mentioned one big word that was family, and I know you have a family yourself. We'll get to that, but tell us a little bit of what it is that you actually do as a nurse for pediatric hospice.
Sure, no problem. So my clinical history is in the neonatal ICU. That's where I started out working, and it was a part of the hospital I have a huge passion for. I know at GBMC we have a wonderful NICU. And I think I developed a strong appreciation and dedication to the end of life. A lot of times in the NICU, children die early and unexpected. And it was something that I definitely found a passion for. So I spent a good amount of time working in the NICU as a nurse, and definitely knew that I wanted to parlay that work into working in hospice and end of life. It's a real thing that happens. Kids die, and people need to take responsibility, which our team has, to make sure this is the best experience through the worst situation. And I think that's where my passion lies.
We talked about family and you working with families, and now you're a mother yourself.
Yes.
So how does that part of you being a mom kind of be part of what it is that the work that you do at Gilchrist Kids? How has that influenced the way you work with families or the patient, for example?
It's been a game changer for me. Not that I wasn't empathetic or sympathetic before, but now I see my child in the eyes of every other child that I care for. I also see myself as a parent in the eyes of the other parents. And I didn't have that experience before. Not that not having children doesn't make you good or not good at this job, but for me, it opened up a whole new place in my heart and my brain for this work. It definitely was a game changer for me.
Let me ask you this question. What kind of reaction do you get from people when you tell them what it is that you do for a living? Like, what is their reaction?
So I think sometimes you're careful and you just say that you're a pediatric nurse. Sometimes I say I'm a hospice nurse. But I think now it's really important that every single person that asks me what I do, I educate on what pediatric hospice is. And sometimes it's brief, it's a one-liner, children die, yes, and we make sure that it's they have the best situation given their circumstances. But I truly feel a calling to make sure that when someone asks me what I do, that I educate them on pediatric hospice, because I think not enough people, just like every other rare disease or breast cancer or any other social issue, it's important for us to stand behind what we do, which is why, it's sometimes it's uncomfortable to talk about, but it's a true situation.
So here's the other question is, if people want to find out what it is that, not necessarily that you do, but the services that are offered by Gilchrist or Gilchrist Kids, what is the best way for them to find that information? Is it going to the website? And if so, what's the website address?
Sure, absolutely. I mean, I do think we have a good amount of information, gilchristcares.org. But I really think if anyone has specific questions about pediatric hospice, getting on the phone and getting one of us on the phone. This is not a topic that you can just bullet point paragraph on a website. This is, real sensitive, specific information. And usually when families have questions, they have questions about their specific child or their nephew or their niece or their grandchild. And we can give a lot more accurate information if we talk to them on the phone or in person. And we're very easy to reach.
We have a question from our audience. Mindy?
We do. The question is, what type of support is given to family, especially siblings, after death?
Absolutely. Well, you're all lucky enough. You'll be hearing from our child life specialist, Beth, who's here. She will be on in a little while. But I think our child life specialist, that's a really valuable role. I think when we meet families and they have a child that's terminally ill, the thing that they are most focused on is their other children. And they often say to us, are our other children going to survive? Are they going to get through this? And often families have held off on having conversations with their other children, and they really need help, and they need the skills that Beth can offer to help them have those difficult conversations. I mean, it's hard enough to talk to your kids about, not talking to strangers. How are you going to talk to them about their sibling possibly dying? So that's, our child life specialist is very valuable.
Again, I'm requesting that anyone from our audience or those of you watching us on Facebook, if you have any questions, please feel free to post them in the comments section, or you can private message them as well. Mindy, we have another question.
Yes, hi. Thank you for being here. I have a question. You mentioned something I just learned about, which I was not aware of, and that is that the Health Care Act in 2010 provides some special benefits in the situation. Under the current administration, is there any risk, or are you getting any information that suggests that kind of addendum to the Healthcare Act will change?
Thank you. That's actually a very good question. And I get that question a lot. So our hope is no, that doesn't change. And here's the reason why. This service, this Affordable Care Act and hospice in general is very cost saving for insurance companies, because we're able to manage patients' symptoms and keep them out of the hospital. These patients are less expensive because we are going into their home. And yes, they're allowed to go in the hospital, but they're going into the hospital way less. So a stay in the intensive care unit is a lot of money, but it's a lot less money for your hospice team to come out to your house and evaluate and assess and treat what's going on. So hopefully they're able to look at the bigger picture and see that this is actually, having hospice involved is actually cost saving. If you look at, for the adult population for hospice, patients with identical conditions, the patient that's on hospice actually goes to the hospital less, costs less money, and their symptoms are managed better, and they actually live longer. So it's a service that's not only valuable financially to the insurance companies, but to the patient as well. It's a really good question.
Thanks, Howard, for the question. Mindy, do we have a comment?
We have a comment from John on Facebook. He said, "God bless you for being there for these children and their families."
Thank you. It's our honor. It truly is.
Again, if you want to find out some more information about Gilchrist Kids and pediatric hospice, pediatric palliative, it's palliative care. Well, I try to get that out as much as I can. Before the program, we talked about concurrent, just work with me here, concurrent care. Mm-hmm. And the difference between that and curative care. Did I say it correctly? Mm-hmm. So can you briefly explain the differences between the two? Are they similar or?
Well, curative treatment means you're trying to cure the child's disease, but that is allowed on hospice through concurrent care. So again, our families don't have to stop trying to cure their child's disease. They can still be on hospice through concurrent care.
Okay.
That is the act that allows this to happen.
Before today's interview, we talked about that when you first started back in 2013, right? It was around about 5 years ago. Gilchrist Kids had about 5 patients. But since then, the program has really grown. In your professional opinion, why is that? Why do you think the program has grown?
So in 2013, our average daily census, we took care of about 5 patients on any given day. Now we take care of between, I would say on average, 35 patients. So anywhere between 30 and 40 patients. And most people think, oh my gosh, does that mean more children are dying? And it doesn't mean more kids are dying. What it means is that we're out there educating the public, educating the physicians, educating the medical groups, that this is a service that families are entitled to. Most families have the hospice benefit under their insurance. So now it's not that more children are dying, it's just that more people are educated as to this service and more families are feeling comfortable choosing hospice for their children.
Earlier, you mentioned about working with your patient and their family. How important is that to the work that you do for you? And also, how is that extremely important with the family? We actually have a family who's joining on our next show, Greater Living, and talk about their journey as well. But for you per se, you get to know the family. Why is that important to your work?
I think for me and I think I can speak for my entire team, the reason we do this is the interface with the families. You know, I'm able to sit right here and look at a family that I interacted with for about 4 years. And these relationships, you know, they're not just, I wasn't just their nurse and their son wasn't just my patient. You become family. You are in their home. You know, I was able to be holding their son's hand as he, like, no joke, as he took his last breath. I mean, that is being in the inner circle. That is an honor that it's not just a job. This is something you've chosen to make a difference.
I know it varies depending on the patient case, but maybe you might have mentioned it earlier in our discussion, but how long does hospice care for a child last?
It's a really good question. So as with adults, to be enrolled in pediatric hospice, you have to have a diagnosis that says you're going to live approximately 6 months or less. With children, as I said earlier, they're not good rule followers. So our children sometimes live for years. That being said, every 60 days, our physician has to go into the home. So our hospice physician goes into the home and recertifies that a patient is continuing to decline or continuing to certify for that life-limiting illness. So every 60 days, we're recertifying that, yes, this patient is close to the end of their life. We can do that as long as the patient continues to decline. I think we have patients that have been on service for years. We also have patients that we discharge. They don't fit qualifications anymore. Either they get better or the family's goals have changed. And that's okay. That no one is locked in. We always tell families, if this is not a service that is benefiting you, then you're not stuck doing this.
We got about 5 more minutes left in our show, so I encourage everyone watching us on Facebook to please send in your questions. And our audience members, if you have a questions, please get Mindy's attention. She'll ask it on your behalf. Mindy, it looks like you do have another question.
I have a question and a comment. So I'm going to give you the comment first. Zoe, one of John's biggest fans, I think,
Maybe
is tuning in, and she said it's very valuable information. Thank you. I also want to share a question from the audience. What age range do you cover?
It's a really good question. Thank you, Zoe. What age range do we cover? So we haven't talked about this. Maybe this is a good time to talk about perinatal hospice. So we have a perinatal hospice team, which is our pediatric team as well. We support mothers who are pregnant and have a child in utero that has a less than desirable condition, meaning the child might die before birth, during birth, or slightly thereafter. So we take care of babies that are in utero all the way up until, I don't want to give an exact age. We have patients that are in their 20s, and we have cared for patients in their 30s. And people think 30s, that's not a pediatric patient. But sometimes you have a 30-year-old who has never left home, who's developmentally delayed, who functions in a family more like a young child. So for instance, we've had a 35-year-old who's had Duchenne's muscular dystrophy. He lives at home. Parents make decisions for him. He probably functions more like a 12, 13-year-old. And it would make more sense that a pediatric hospice team would care for him. I would say the majority of our patients fall in the pediatric age, but we do have our outliers that are in their 20s and 30s.
We got a couple more questions before we end our program. But again, if somebody wants to find out some more information, what is the website?
GilchristCares.org.
Awesome. Fantastic. Okay. 2 questions. One, does insurance cover the care a child receives from Gilchrist Kids?
Most do. Anyone with Maryland medical assistance, absolutely. If a patient's insurance does not cover, they can be covered by charity care. But most patients' insurance they have a hospice benefit.
Okay. And one question that was given to me by a friend of mine, she asked, are families with a child in hospice allowed to travel with or without their child or children? Sorry.
Yes. So we actually encourage our families to travel with their children that are on hospice. There's a beautiful program that covers, so wherever the family travels, we contact the pediatric hospice in their area, and they cover them while they're in that area. We call it a travel contract. A lot of our kids do what's called Make-A-Wish. So let's just say they go to Florida for their Make-A-Wish. We call the local pediatric hospice in Florida, and while the family's there, they can call that hospice if they need anything. Also, a lot of our families, they need to travel while their child's on hospice without their child. Let's just say that a family member dies and they need to go to a funeral, or there's a wedding, or sometimes mom and dad just need to get away for a little while. We have a state-of-the-art inpatient hospice unit, so it's specifically just for pediatric patients, and our patients can respite there while the families go away. We have fully staffed nurses, physicians in the inpatient unit just for pediatrics so that families feel comfortable going away while their child is being cared for by these professionals.
Before we wrap up, we do have a comment or a question, Mindy.
Another comment. This is probably a good place to end on. It's Grace is saying, Erin, your dedication is appreciated. And I think we all
Thanks,
agree
Mom.
with Grace. Oh.
On that note, I want to thank everybody for joining us here in the studio, and also for joining us on Facebook today. Erin, I want to thank you. I know this is a very important subject matter to you, because you told me it's not a job to you, right? You know what I mean? You really have taken ownership on what it is that you do and how you help families. And I want to thank you for coming here today, as well as your colleagues that have come out here today to enlighten all of us on the services that is offered at Gilchrist, especially for kids and adults too. You know what I mean? So I want to thank you again for coming out. Stand by. The conversation on pediatric hospice and Gilchrist will continue on Greater Living with Mary Beth Marsden and Don Scott. See Don in the corner. Hey Don, how's it going? Good, he's waving back. All right. Please join me next month here on To Your Health, as we are joined by Laura Clary, who is the clinical program manager for our SAFE program. She's going to talk about a coming event in April called Walk a Mile, to raise awareness about sexual assault and domestic violence. And also a pretty cool initiative that will soon be underway with our SAFE program and at GBMC. Again, from myself, I want to thank you all for joining us today. Erin, thanks again. And until next time, everyone, here's To Your Health.
Thank you.